I'm going to show you how to section a patient. So the first thing I'm going to do is look at my patient's chart, look for indications for sectioning, his history, and see how he previously tolerated the treatment. Then I would go to my patient's room. I would wash and sanitize my hands before going into his room. Upon going into his room, I'd introduce myself. Hi, Mr. Doe, I'm Lauren from Respiratory. I'm going to be sectioning you today. Then I would check and make sure that I have the correct patient. Then I would check his vital signs, see how he's doing, and then I'm going to listen to his breath sounds, see if he actually needs to be suctioned. And he does sound coarse, so we are going to suction him today. So some of the things I have with me in order to suction him are my inline catheter, I have my canister over here, and then I also have my Yankar, and then my saline in case I need to lavage. Next, I would put him in semi-Fowler's position. So I'd prop him up like this. I would tell him, Mr. Doe, I'm going to suction you today. Previous to suctioning him, I would go ahead and check my suction. I would make sure it's between -100 and -150. I would hyperoxygenate him for up to 30 seconds. I would check my thumb port, make sure it's unlocked, and then I'm going to go ahead. Mr. Doe, I'm going to suction you. You're going to have to cough. So I'm going to go ahead and go down with the suction catheter, making sure not to stay down longer than 15 seconds, and I'm monitoring his vitals at the same time. Once I meet resistance, I'm going to pull back and then pull out with intermittent suction. I'm going to let him recover, hyperoxygenate him again for up to 30 seconds. After he recovers, I'm going to listen to his breath sounds, see if he needs to be suctioned again, see if he's all good. He sounds clear, so I think he's okay with that. I'm going to lock my thumb port, make sure that nothing happens with that. And then I'm going to go ahead and suction him in with his mouth with the Yankar. Mr. Doe, I'm going to suction your mouth. Get all the secretions out of there. And then after that, I'm going to go to the chart and chart and make sure that I have everything down, how he tolerated the treatment, the amount of sputum, the color, and all that stuff.